for this presentation now, I'll be presenting the PIDS UNICEF project, the Tracking Nutrition Investments, a guidance note for the national government agencies in the Philippines. So let me just check. I think this is not the latest slide. Okay. So first, this project was first conducted in partnership with UNICEF, and this emanated from a previous PIDS discussion paper on public expenditure review for nutrition. So I acknowledge the presence of my co-authors, Ms. Joy Bagas, Dr. Val Ulep, who is present here today. So this presentation will be very brief as it veers away from the usual format, given that it proposes a method or framework on tracking nutrition investments for the national government agencies. So the presentation will discuss six main parts, including the rationale, methodology, the proposed framework and typology, a sample use case, proposed budget tagging process, and the limitations and recommendations. So first, to provide a rationale for the NBT, so we know that adequate and efficient public spending is vital in addressing the long-standing problem of malnutrition in the Philippines. And long before, there is no institutionalized system in place to monitor health and nutrition spending. And critical policy questions are often left unanswered. These include if we have the adequacy of public spending on nutrition and the efficiency of spending, that is, if our resources are strategically allocated to the cost-effective intervention. So a systematic and efficient tracking system is needed to obtain regular, reliable data on nutrition spending. And this system enables decision making to prioritize and allocate resources and promote transparency and accountability among the implementing government agencies. Next slide, please. So our current public financial system does not allow a systematic and easy way to track the nutrition expenditures both in the local and in the national level. So this means that there is no standardized system of reporting nutrition expenditures, and previously conducted expenditure reviews relied on post hoc secondary analysis of public financial data, which could be very tedious and time consuming. So in addition to these technical issues, the government agencies implementing programs that may have an impact to nutrition are unaware, and their accountability is not clear. So this could affect the reviews, as there may be programs that could not be captured. Next slide, please. So what is the value of having this NBT in the Philippines? So this provides a systematic process in tracking the expenditures across the national government agencies, and this will be used to tag the nutrition line item expenditure. So this typology was designed to align with the PPAN, or the Philippine Plan of Action for Nutrition, with the reform actions such as the universal healthcare and multi-sectoral and life force approaches to health and nutrition. So next slide, please. Briefly, we will describe the methodology for crafting the NBT framework and typology. So the process is presented here in this slide, but I will not describe in detail, because this is just the description of the whole process that we did in coming up with the framework. So first, of course, our view of related literature, including the budget tagging guidance note from other countries. Second is the consultations with stakeholders, for instance, UNICEF and NNC. And third, based on these initial consultations, we reviewed the other literature, the NBT framework, and full typology on the reference list for the tags and codes for the budget expenditure line item that was crafted, which will be presented in detail later. And fourth, this framework, along with the full typology, was validated with select government agencies to ensure the appropriateness and the sufficiency of the typology framework and the line items listed. So fifth, this also, the typology was pre-tested with existing documents submitted by the national government agency. And lastly, this typology was revised and finalized based on the issues encountered from the pre-testing phase. So more typology items were added to cover for other possible line item expenditure. Next slide, please. Okay, so in this slide, we just briefly describe that these different agencies, the Philippine national government agencies, have various roles in nutrition, right? So these are their main mandates and their sample programs that we are expecting to have a contribution in the nutrition spending in the national level. Next slide, please. Okay, so in the next few slides, we'll be presenting the NBT framework and typology to be used in the nutrition budget tag. Next slide. Okay, so the NBT framework illustrates the classification levels of the typology crafted based on the guiding frameworks, literature, financial documents, and validation sessions from the national government agencies. So it comprises 5 levels of classification elements with 3 additional markers to group and tag the nutrition relevant line item expenditures according to these different domains. So briefly, I will run through each classification level. So first, we have the major intervention classification, which are the nutrition specific or direct and the nutrition sensitive or indirect. So direct interventions, as described by Buta et al. In 2020, are nutrition interventions that addresses the immediate determinants of malnutrition, while the indirect interventions are those interventions that addresses the underlying or enabling determinants for malnutrition. So each expenditure by a certain national government agency will be tagged if their expenditure is first direct or indirect. And then after that, that expenditure will further be tagged if depending on the nature or the program domain that expenditure will fall under. So for example, based on our guiding frameworks and review of relevant literature, here listed in this slide are the program domains that one nutrition expenditure could be classified on. So first we have here, for example, micronutrient supplementation under direct, IYCF, and then under indirect we have adolescent health and development, oral health, family planning, WASH, and other program domains. So after tagging on which program domain that expenditure will fall under, we will now tag them depending on their program component classification. So this classification level is to categorize the nutrition investments according to the type or the nature of the activity. So this includes either policy and governance, research and surveillance, human resource and capacity building, advocacy and promotion, and service delivery. So and then after that level, we now go to the specific intervention. So these are the coded line items of specific interventions or PAPs under the first 3 levels of classification. So this will be the basis for the tagging of the line item expenditures. And then after that, we have here other markers, including the determinants or risk factors of malnutrition marker, the nutrition intervention focus area marker, which are health and nutrition, knowledge building, food production, social protection, and what. And then population demographic group marker, which corresponds to the age and if that specific expenditure is or contributes to activities for the women of reproductive age. Next slide, please. Okay, so just to show briefly that there is this identified coding diagram for each expenditure line item that corresponds to the classification levels that I have described earlier. So next slide, please. Okay, so just to provide a brief picture of what of how the typology looks like. So here, as mentioned earlier, there are specific interventions list for each of the major intervention level and major program domain. And here, the codes are pre-identified for the assigned persons to tag the expenditure line item. So for example, if there is an expenditure on the say procurement of vitamin A capsules, I mean for commodities, so this will eventually be tagged as this code, and then it's pre tagged to be under nutrition specific, micronutrient supplementation, and under service delivery. Next slide, please. Okay, so we all know that in the national level, not 100% of that spending amount could be attributed fully to nutrition outcomes. So, according to relevant literature in other settings, they use a weighting criteria to estimate only the proportionate amount that can be attributed to an outcome to the nutrition outcome, right? So here in our proposed typology, we use the quadruple system according to the Sun guidance note, and in that system, all nutrition specific or the direct expenditures or direct nutrition intervention will be weighted 100%. And then for the nutrition sensitive shown in the slide are the specific weights for each program domain. Next slide, please. So of course, being the first or initial stages of this typology, it is not without limitation. So first, the complete classification levels described earlier may only be used if the financial document that we'll be referring to is or can be tagged up to the activity level expenditure. So here we refer to the program plan of each of the program managers of each agency, because if the expenditures are lumped per program, the tagging can only be done up to level 1 or level 2 program classification. So it's only up to the program domain. And then on select lump expenditures, which is, for example, cross-cutting expenses or support to subnational offices, there may be a program component misclassification and overlap. Thus, the program managers should be facilitated and should be able to choose and tag the expenditure according to the program component where it is best fit or most appropriate. Next slide. Okay, so in the paper, we shown sample tables. I think it's just not reflected in in this version of the slide deck, but there we shown the sample tables that you can regularly generate if you have a systematic way of tracking nutrition investments. So this can also be made public and visualized in various manners, such as the dashboards, which can be easily accessible to program managers and policymakers and open to the public for scrutiny. So why am I saying this? It's because this presentation may be a sort of methodological in this sense, but the use for this typology could be beneficial to our program managers because we can generate regularly statistics on how much are we spending for the threshold. So in the following slides, we will discuss now the budget tagging, the proposed budget tagging process once it is institutionalized. So ideally, we envision the National Nutrition Council as the highest governing body in nutrition, as they should spearhead the establishment or institutionalization of this system. So next slide, please. Okay, so the first step, of course, is to prepare the financial data to be used in the nutrition budget tagging. So to provide activity level budget items, we expect that the work and financial plans or similar documents should be necessary. So using this level of disaggregation of line items in the WFPs, the disbursement data or the activity level expenditure should be traced accordingly. So this may be gathered from other relevant documents, but the program manager or the assigned staff should of the relevant national government agency should be in charge in organizing and collating this document. Next, the accomplished NBT sheet should by the corresponding agency should be used by the program managers to tag these expenditures mentioned coming from the prepared financial data using the framework that we have described earlier, and a tool, an Excel tool at the simplest form, could be used for this purpose. So next slide, please. So the sheet I mentioned after tagging should be submitted and compiled and submitted to the National Nutrition Council for analysis of the tag expenditures and for the generation of the tables to be used and according to what the NNC will be envisioning, right? Okay, and then for the step 4, the results of the nutrition expenditure tracking analysis should be reported regularly for the decision makers and policy makers and the general public scrutiny. So ideally, we're looking at seeing this or these regular statistics in perhaps an online dashboard, which may be accessible at the probably NNC's website. Having easy access to these statistics on an annual expenditure for nutrition relevant activities will help them observe patterns in nutrition spending and critically assess if there are changes needed in the prioritized for nutrition investment. Next slide, please. So as you may have inferred, the tagging process is highly dependent on the assigned program managers of the relevant offices, as the first few steps of this process will be done by them. So they should be capacitated well on the objectives of the expenditure and the implementation processes of this exercise in order to achieve the desired outcomes. And due to unstandardized formats of financial documents from agencies, different difficulties may be encountered by agencies in compiling the financial data. Next slide. So moving forward, we only have 2 points here to consider in improving and advocating for the budget tagging in the future. So first, the typology or the framework is very dynamic. Thus, continuous improvement of this framework should be done through subsequent pilot testing and periodic refinements. And then the most important point is, of course, we should actively push for policies and issuances for the institutionalization of the system. So this is not just limited with the framework, the typology that we have described earlier, but the success of this system is highly dependent on the push and the capacity of our public financial system and the national agency, because in order to have that ideal system, we might need to revisit also how we report the financial documents, how or the standards on the documentation for this to be efficiently done regularly. Next slide. Okay, so that's it for this paper. It's very brief because it discusses more on the method, but this just describes how this nutrition expenditure should be tracked and reported to the public. Thank you so much.